I had a past client, haven't seen her in quite a few years, and she came in for rehab, I'd say probably April, May. This is a few months ago now, and complaining of shoulder pain for the last 9 months. She's had 42 physiotherapy sessions that, helped initially a little bit in the beginning and then tailed right off. When I assessed her, she could barely move her arm. Her range of motion was definitely sore within the painful arc.
Wasn't she told? She was told she had frozen shoulder.
At one point, and she actually started developing that because of poor management.
That's right.
Long and short of it is I quickly determined that, or I felt she had a rotator cuff tear. It was fairly obvious, and it was creating impingement, which they normally will, especially when they become chronic. So we brought out the trusty G Logic E here. I had a look, and once again, I'm going to qualify this as I always do to my clients. I am not a sonographer. I'm not a radiologist. I'm not allowed to make a diagnosis, but I have taken courses that have allowed me the basics, and I can have a look and see. So I determined what I thought was a tear in her supraspinatus. You just happened to be walking by and heard it. Yes. And walked in and went, "What tear?" Yeah. So I handed it over to Dr. Berghamer.
Yeah, and I've been trained in ultrasound, and I'm by our naturopathic doctors are allowed to diagnose by ultrasound. So I came in and tweaked Dean's placement of the probe and determined that she had a pretty significant tear in her supraspinatus tendon, which is the nice thing also about having an ultrasound in the clinic, immediately applicable, a point of care to be able to determine this. We don't have to send them off to the medical doctor to get a referral to an ultrasonographer. Wait weeks for that to happen, then wait weeks for the report to be able to have that kind of type of care available to us.
So let's expand on that story. She was immediately diagnosed with the tear. Right away I said no more physio, and we referred her to you. She was injected within the next week or two. Yes. With PRP, had soreness as usual. My colleague Derek Hansen and myself are writing actual pre and post injection protocols. We're not just talking about injections here, where most clinics are not.
Most clinics are not using anything in terms of pre or post. Essentially, they say, "Does it hurt here?" and then they inject, and they have no follow-up care beyond more injections.
So in force balance technique, once again, it's all about precision and efficacy and well thought through process. So her story was that she came in with 9 months of pain, lots of money spent, was immediately referred for the appropriate treatment, which was orthobiologics at that point. She had a couple weeks of soreness, came back for her follow-ups. We did potentially half a dozen visits of just some straightforward range of motion. Got her into the second phase of neuromuscular, FBT, improved her range really quick, and done, fixed. I saw her, I was away for the summer. I just saw her a month ago in September, smiling, and I said, "Hey, how did we do?" And she went, "This is how we did." So I want to illustrate one quick point. We're doing this all the time now here with many of these cases, is that this is how it normally goes. They come in, client comes in, they've hurt themselves. They've tried conventional therapy, which is what you should do. That's a good course of action. The ones that don't prosper there or fail are back at their doctor, or they're trying other forms of therapy. Once again, they throw something against the wall, hopefully something sticks, which is expensive and costly. That fails. 6 months to a year later, they're back at their doctor's still complaining. The doctor decides to do some imaging. So in the public system, it takes about 4 to 6 months to get an MRI now. The wait lines have come down. Yeah, but you're still in that line for 3 to 6 months. So now we're at a year and a half. They come back, the doctor reads the results. Yep, you've got a tear. So immediately there's a decision to be made. What do we do? Do we do more of the same, or do we send them to a specialist? Typically they're going to be sent to an orthopedic specialist at that point. So they'll be sent to a surgeon, say it is a shoulder surgeon, and that's going to take 6 months to get in to see that. We're at 2 years now. And the surgeon will bring them in, they'll look at the radiograph, they're going to do some orthopedic testing and determine at that point they're not surgical. Now I'm generalizing, they could be surgical at that point. The surgical care here is excellent. I don't know many surgeons, if any, that are just going to operate. Our standard of care is very excellent surgically, but unfortunately I see this all too often that they're not surgical. Now what? Well, I'm here to tell our audience that now what is orthobiologics. and it bridges the gap. For years now, people have been suffering with this no man's land business of you're not surgical, but conservative therapy has failed you, and you're 2 years, 3 years into this thing, several thousands of dollars down, lack of quality of life, the whole gamut. Well, with all due respect, we take you, look, see, immediately diagnose, give the appropriate and adequate care, and you're done. Like that was, what was that procedure for her? That ultimately, I'm gonna say 3 months maximum, right? And that's truly how it should be handled. You know, just to summarize, you know, Dr. Berghamer here is, we've known each other for quite a few years now, and Dr. Berghamer is excellent in this field and has taught me many things. He's one of the best orthopedic naturopathic doctors I know, if not the best. Being able to harmonize our treatment plan along with what Derek's doing neuromuscular is just, it's a godsend for our clients.
It is. It's next level of care is what it is. And I've been doing injection therapies for over a dozen years. In my experience, it's just as a standalone treatment, it's just not effective. It's no different than injecting cortisone. Put into the context of a therapy-based system where we can follow a set line of protocols, results in outcomes that people want.
My point is that, yeah, effectiveness. The only thing we've ever concentrated on here for sure is results. So we keep upping the game, and now we have a process, force balance technique, that's quite simplistic. It's managed well, it's quarterbacked well. I'm the clinical director here, and I've got some excellent heads of state now. So yeah, you don't have to suffer anymore. No one really needs to suffer. It doesn't mean we have a cure-all or a magic bullet. Force balance technique is not the next coming of you know, the ultimate system, but it is a system that we've come to rely on time and time again for extremely difficult cases, and it works.